So let me discuss the other anti-cancer drug, that is Enginol Mebutate. So we have a drug which is called as, Enginol Mebutate. Now remember, this particular Enginol Mebutate, it is an inducer of apoptosis. Right? What does it do? It is an inducer of apoptosis. Now what is this particular apoptosis? Apoptosis, it is nothing but a programmed cell death is called as apoptosis. So remember, Enginol Mebutate, it is an inducer of apoptosis, and this is specifically indicated for topical treatment of actinic keratosis of face, scalp, trunk, and as well as the extremities, right? So if you take the uses of this particular Enginol Mebutate, it is indicated for, the topical treatment, topical treatment of actinic keratosis of face, actinic keratosis of scalp, trunk, and as well as the extremities. Now this actinic keratosis, what exactly this mean? Actinic keratosis, this is also called the solar keratosis, right? So whenever the individual skin is being exposed by the UV light, then there will be scaling of the skin or formation of the keratin plugs within the skin. So that is called as the actinic keratosis. So Enginol Mebutate is the drug which is used for actinic keratosis. Next we have the another important drug which is called as idelalisib, right? The other drug, that is idelalisib. Now if you take this particular anti-cancer drug, that is idelalisib, remember it is a small molecular inhibitor of PI3 kinase delta, right? It is a small molecular inhibitor of, PI3 kinase delta. All right. Now where is this particular idelalisib indicated? Remember, it is approved for the oral treatment of relapsed chronic lymphocytic leukemia, indicated in case of follicular B-cell non-Hodgkin's lymphoma. So remember, it is approved for the treatment of relapsed chronic lymphocytic leukemia, and it is also approved for follicular B-cell, non-Hodgkin's lymphoma. So that is about your idelalisib. Next, after having discussed about the idelalisib, we have another drug which is called as 𝗠𝐫𝐲𝐫𝐞. This particular drug, that is 𝗠𝐫𝐲𝐫𝐞, it is actually a prodrug, and this is converted into an active form that is called as sirolimus. So this 𝗠𝐫𝐲𝐫𝐞, this is a prodrug, it is converted into the active form, right? This is converted into active form. So what is the active form of this particular 𝗠𝐫𝐲𝐫𝐞? The active form of this 𝗠𝐫𝐲𝐫𝐞, it is converted into the sirolimus. Now if you take this sirolimus, the another name of this sirolimus, it is called as rapamycin. Alright, this is called as rapamycin. Now you take this sirolimus or rapamycin, later with this sirolimus or rapamycin, it is a specific inhibitor of mTOR, right? Specific inhibitor of mTOR. Now what does this mTOR stand for? It is the mammalian target of rapamycin, right? The word mTOR stands for mammalian target of rapamycin. Now where is this particular 𝗠𝐫𝐲𝐫𝐞 or the sirolimus is approved for? Remember, it is approved for advanced renal cell carcinoma, right? It is approved for advanced renal cell carcinoma, right? Now if you take the adverse effects of this 𝗠𝐫𝐲𝐫𝐞, the adverse effect is this is associated with interstitial lung disease, right? It is associated with the interstitial lung disease. So this is about your 𝗠𝐫𝐲𝐫𝐞. So the other important anti-cancer drug is palbociclib, right? So this particular drug palbociclib, it is an orally effective cyclin dependent kinase 4 and as well as 6 inhibitor, right? Route of administration is oral route of administration, and if you take the mechanism of action of this particular palbociclib, it is CDK4 and as well as 6 inhibitor, right? It is CDK4 and 6 inhibitor. And what does this CDK stands for? This CDK, it stands for cyclin dependent kinase. Now, if you take the uses of these drug, that is palbociclib. Palbociclib, remember, it is approved in combination with letrozole for postmenopausal women with estrogen receptor positive and as well as HER2 negative breast cancer. So this palbociclib along with the drug letrozole. So this particular combination, that is palbociclib and as well as letrozole, in combination they are used for postmenopausal women, right? In case of the postmenopausal women with ER positive, that is estrogen receptor positive, and HER2 negative, that is human epithelial growth factor receptor 2 negative breast cancer, right? So this is the indication of your palbociclib and as well as letrozole combination. Next, apart from this palbociclib, the other important drug we have what is called as 𝐒𝐻𝐵𝐷, right? So if you take this particular drug 𝐒𝐻𝐵𝐷, now let me tell you where is this approved for. 𝐒𝐻𝐵𝐷, it is a protein synthesis inhibitor. So it will inhibit the protein synthesis of the neoplastic cell, right? Protein synthesis inhibitor. Now, where is this indicated? Remember, it is the drug which is approved for chronic phase of chronic myeloid leukemia, right? Approved for chronic phase of, right? Chronic phase of the chronic myeloid leukemia. Now the point is, how does it inhibit the protein synthesis? If you take the human ribosome, like mainly we have the ATS. In the ATS, like we have the 60S subunit and as well as the 40S subunit. And within this particular 60S subunit, like you have A site and as well as the P site, right? The attachment site and as well as the peptidyl site. Now you take this drug, that is 𝐒𝐻𝐵𝐷. 𝐒𝐻𝐵𝐷, it binds to the A site. By binding to the A site, it will prevent the elongation step in protein synthesis. Okay, so all right, it binds to the A site, right, and prevents the elongation step in protein synthesis. So this is about the drug 𝐒𝐻𝐵𝐷. Now, after having discussed about the 𝐒𝐻𝐵𝐷, we have another group of anti-cancer drug that is called as the proteasome inhibitors. Proteasome inhibitors. Now, if you take this proteasome inhibitors, we have two important drugs. One is bortezomib and the other drug is carfilzomib. Right, bortezomib, and another important drug what we have is carfilzomib. So if you take these drugs, that is bortezomib and as well as carfilzomib, let me tell you the mechanism of action of these drugs. Remember, they act by inhibiting the proteasome. So once it inhibits the proteasome, it results in the downregulation of NF-κB. So this bortezomib and as well as carfilzomib, what is the mechanism of action? They act by inhibiting, right? They act by inhibiting the proteasome. Now, what is this particular proteasome? Remember, proteasome, it is a protein complex which will cause the degradation of unneeded protein complexes by proteolysis, right? So what is a proteasome? It's a protein complex. What it will do? It will cause the degradation of unneeded protein complexes by proteolysis. That is, it will cause the breakdown of the peptide bonds. So what this bortezomib and as well as carfilzomib will do is, it will inhibit the proteasome. By inhibiting the proteasome, it will cause or it will result in the downregulation of the NF-κB. Right, downregulation of the NF-κB, that is nuclear factor kappa chains. So this NF-κB is the one which is involved in cell survival, right, which is involved in cell survival. Now, what is your proteasome inhibitors doing? Proteasome inhibitors are inhibiting the proteasome. Once the proteasome is being inhibited, that will result in downregulation of NF-κB. NF-κB is the substance which is involved in cell survival. Now, where are we giving these particular drugs? Remember, this particular bortezomib and as well as carfilzomib, they have been approved for the treatment of resistant multiple myeloma, right? So in case of resistant multiple myeloma, we are using this bortezomib. Now in case of multiple myeloma, it is a disorder of the plasma cells. So we want that there should not be abnormal proliferation of the plasma cells. So whenever you give these drugs will reduce the survival of the plasma cells in case of multiple myeloma, and thereby the individual will survive in patients with multiple myeloma when the individual takes bortezomib or carfilzomib. Next, now you remember here, so let me shortly revise here. If you take the drug that is palbociclib is an orally effective cyclin dependent kinase 4 and 6 inhibitor, and it is approved in combination with letrozole for postmenopausal with estrogen receptor positive and HER2 negative breast cancer. And you take the drug that is 𝐒𝐮𝐵𝐷𝐼𝐻. 𝐒𝐿-𝐵𝐷𝐼𝐻, it is a protein synthesis inhibitor approved for chronic phase of chronic myeloid leukemia, right? And how does it will inhibit the protein synthesis? It binds to A site and prevents the elongation step in protein synthesis. And we have the another group of anti-cancer drug, that is proteasome inhibitors. Proteasome inhibitors, that is bortezomib and as well as carfilzomib, they act by inhibiting the proteasome, resulting in the downregulation of NF-κB. NF-κB is the one which is involved in cell survival. And where do we use this bortezomib and as well as carfilzomib is in case of resistant multiple myeloma, we use this bortezomib and as well as carfilzomib. Now let me discuss about another important drug that is called as zoledronic acid. So if you take this particular drug zoledronic acid, as such this is a bisphosphonate, right? As such this is a bisphosphonate. And where is it used actually? This zoledronic acid is used in the treatment of osteoporosis, right? If you take in case of malignancies, remember it is a bisphosphonate indicated for the treatment of bony metastasis and as well as multiple myeloma, right? So this is a bisphosphonate indicated in case of, right, indicated in case of multiple myeloma and as well as bony metastasis. Now apart from this particular zoledronic acid, we have another group of drugs which are used in case of malignancies, that is histone deacetylase inhibitors, right? They are called as histone deacetylase inhibitors, right? Now if you take these drugs, that is histone deacetylase inhibitors, we have the two important drugs in the histone deacetylase inhibitors. One is vorinostat and as well as romidepsin. So if you take these drugs, that is vorinostat and as well as romidepsin, these are histone deacetylase inhibitors, right? These are the histone deacetylase inhibitors. Now where are these drugs used? Remember this vorinostat and as well as romidepsin, it is approved for cutaneous T-cell lymphoma. Alright, it is approved for the cutaneous T-cell lymphoma. So that is about these drugs, that is vorinostat and as well as romidepsin. Now apart from these drugs, that is vorinostat and as well as romidepsin, we have another important drug that is called as penobinostat. So if you take this drug, right, if you take this drug that is penobinostat, remember this is one of the new drug in this category and it is approved for multiple myeloma, right? It is the drug, it's a new drug in this category of histone deacetylase. So histone deacetylase inhibitors. So the drugs in this group, like we have vorinostat and as well as romidepsin, these are basically histone deacetylase inhibitors. They are approved for cutaneous T-cell lymphoma. And we have a new drug in this, that is penobinostat, and this is approved for the treatment of multiple myeloma. Now next, if you see, next to this particular penobinostat, we have another important drug that is called belinostat, right? The other important drug, that is belinostat. Now if you take the belinostat, remember this is another drug in this group which is approved for relapsed or refractory peripheral T-cell lymphoma, right? Approved in case of relapsed or refractory peripheral T cell lymphoma, right? That is about your drug belinostat. Next to the belinostat, the other drug what we have is mitotane. Now, where is this mitotane being used? Remember, mitotane, it is indicated for the palliation of inoperable adrenocortical carcinoma, right? So very particularly we use this in case of the Cushing syndrome, right? Cushing syndrome is a disorder which is characterized by excessive production of the corticosteroids. So usually in case of Cushing's, the treatment of choice is the surgical excision of the adrenal tumor. So in case of inoperable adrenocortical carcinoma, this is indicated for the palliation, right? So this is indicated for palliation in inoperable adrenocortical carcinoma. So that is about your mitotane. Now, whenever you are using this mitotane along with spironolactone is a potassium sparing diuretic. So concomitant spironolactone, it interferes with the adrenal suppression which is being produced by the mitotane. So one of the drug interaction what you need to remember of this particular mitotane is whenever you are using this mitotane along with spironolactone, right? Along with spironolactone, it's a potassium sparing diuretic, right? So mitotane, whenever it is used along with spironolactone, it interferes with the adrenal suppression which is being produced by the mitotane. So this combination, right, it interferes with the adrenal suppression which is being produced by the mitotane. So remember, like we have the drugs that is zoledronic acid. It is a bisphosphonate used in the treatment of multiple myeloma and as well as bony metastasis. And we have the other group of drugs that is called as histone deacetylase inhibitors. The drugs in this group are the vorinostat and as well as romidepsin. They are histone deacetylase inhibitors which are approved for cutaneous T cell lymphoma. And we have another drug that is called as penobinostat used in the multiple myeloma, and it is one of the new drugs. And we have the drug called belinostat which is approved for relapsed or refractory peripheral T cell lymphoma. And you take the mitotane, it is indicated for palliation of inoperable adrenocortical carcinoma. And the drug interaction of the mitotane is that concomitant spironolactone interferes with the adrenal suppression which is being produced by the mitotane. Now let me tell you the another anti-cancer drug that is called as the olaparib. So if you take this drug that is olaparib, remember it is used for oral treatment of ovarian cancer, right? Oral treatment of ovarian carcinoma. Now if you take the mechanism of action of this drug that is olaparib, remember it is a poly-ADP ribose polymerase inhibitor, right? It is a PARP inhibitor. So if you take this PARP, this stands for poly-ADP ribose polymerase inhibitor, right? This is called as PARP inhibitor which is used in the oral treatment of the ovarian carcinoma. So route of administration is the oral route. Next, apart from this drug olaparib, we have another important drug that is called as aldesleukin, right? Aldesleukin. Now if you take this drug aldesleukin, remember it is one of the recombinant interleukin 2. And where is this used? Remember, this aldesleukin is used for the management of renal cell carcinoma and as well as malignant melanoma, right? It is a recombinant, right? It is a recombinant interleukin 2, and this is used in the treatment of renal cell carcinoma and as well as malignant melanoma, right? As well as the malignant melanoma. So that is about your aldesleukin. Next, let me tell you about another drug which is called as denileukin deftitox. So if you take this drug denileukin, right? Denileukin deftitox, remember it is a combination of the interleukin 2 with diphtheria toxin, right? It is a combination of, right? It is a combination of interleukin 2 with diphtheria toxin, right? With diphtheria toxin. Now, where is this used? So, if you take the uses of this denileukin deftitox, remember it is used for cutaneous T cell lymphoma. Alright, it is used for cutaneous T cell lymphoma. So that is about your denileukin deftitox. Now, after having discussed about these anti-cancer drugs, now let me tell you two terminologies, that is adjuvant chemotherapy and as well as neoadjuvant chemotherapy.